is not about, is it really about employing 100, 200, 300 staff, doctors as per se? Because the people that actually left Nigeria to find greener pasture, they didn't say they did not have employment. They are saying that the working environment was not conducive, and also the salary was not helping matter. So what is a tendency that the government is ready to take good care of these ones that they want to employ?
Fantastic. Because while you were reading it, I was smiling. And like ASU, Johesu and Enemy have been striking back to back to back to back to back like fireworks. The question is not, can we employ? The question has always been, what are the terms of service? You have seasoned medical practitioners who have left Nigeria. In the last year, a report I saw a few days ago has it that almost 200,000 medical doctors alone have left Nigeria in the last 9 months. Over 1.2 million medical practitioners have left Nigeria in the last 9 months. And the report was coming from the British House of Commons, where a wing of the Tory were saying, we have to stop this influx. So they are even targeting stopping medical practitioners coming into their country. So it's not just students, because they are also seeing a population management crisis for them. Even if they need our professionals, they are also looking at space. Can we manage this? Yeah. So the question is not employing. When you employ, what are the terms of service? I have it on good information that even interns, medical interns who finish their internship since somewhere around June have not been paid their hazard allowances. So what makes you think they want to work for Nigeria or in Nigeria? Last week, the chairman of the House of Representatives Committee on Health was addressing the Luth situation, and how that 5 wards had been shut down due to the same Japa syndrome. And the chief medical director of Luth came out yesterday or 2 days ago to say, no, it's not. It was shut down due to renovations, even if we cannot ignore the obvious crisis we have, where we do not have enough medical practitioners, and the ones we have are leaving.
So could it be that the federal government is not aware why these doctors are traveling out, or they don't just want to do something about it?
It's impossible to say the federal government are not aware, because it's the exact same reason why the Nigerian Medical Association are striking. Exact same reason why Johesu are striking. What is the hazard allowance? How much is the salary? How do you compare it with what their colleagues are earning? Not in Europe, even in African countries. In Botswana, entry-level nurse earns $2,000 a month. Basic salary. Botswana is in South Africa here. Let's not talk about the UK, let's not talk about Canada, let's not talk about the US. Africa. In Ghana, it's about $1,200 or $1,500 a month. My ECOWAS passport, I can walk into Ghana at any time I want. So why do I want to work for the Nigerian government? Why do I want to work at UPTH? I can assure you, when they employ this 100, in 3, 4, 5 months, out of these 100, 50 or 60 will migrate as well.
And it's also possible that the people that are actually coming to be employed are just coming to save up.
It's
so
time, I'd rather be working there than not doing anything.
Yeah.
As I'm working, I'm writing my international exams. I'm writing my IELTS.
Some months back, the Lagos State Governor, that Sanwo-Olu, came up to say something that now they want to create a good work environment for medical doctors and also make sure that they take care of them. So when you are like, it is possible that they are not aware, and I'm wondering how. Because they know the reason why these people are moving out, and then they don't want to do anything about it, and they keep on employing. why would they employ when they have not done anything about the situation on ground? I mean, what do they think? And I saw in a report where a governor said the university should employ more medical students. I mean, it should give admission to more
medical students.
Yeah, so that when those ones come out,
they are ready doctors.
What exactly are they expecting? What do they want?
The Lagos State government can make that statement and can fulfill it. The state government is not the same with the federal government, and I'm sure you'll agree with me when I say that most state governments began to pay the minimum wage before the federal government began to pay the minimum wage. So that's how it works. If the Lagos State government comes out to say, I'm going to triple the salaries of all the medical practitioners under my employ, that's the state government. It's not the federal government. You understand what I'm saying? Yeah. I took you a few years back when the NUJ were on strike nationwide, and the former governor of River State, Nyesom Ezewonwike, had a meeting with the NUJ in Port Harcourt, in River State here, and told them, you dare not. Am I owing you? No. Am I not paying your allowances? Yes. Why are you going on strike? Do you understand? So that's how it works.